YouTube script, score boost method 2, the context, chronology, severity framework. Want a method that can instantly improve how you read any USMLE question and help you avoid missing key clues? Let me show you the context, chronology, and severity framework. This strategy helps students go from confusion and guessing to confidently finding the right answer, even when the question is long, tricky, or out of order. Part 1, Context. Don't judge too fast. Most symptoms in medicine are not specific. Let's take chest pain as an example. Chest pain alone doesn't mean heart attack. Could be GERD, could be a panic attack, could be a pulmonary embolism. Even if you see elevated troponins, that still doesn't confirm it's a heart attack. Other things like myocarditis or renal failure can also raise troponins. Same goes for ST elevations. Those can happen in pericarditis too. The key is context. Ask, how do these clues fit together? Instead of chasing one keyword, put the pieces together. Chest pain, elevated troponins, ST elevations. Now the full context supports acute MI. The wrong way to approach a question, panic. Skip to the last line, look for a buzzword, guess the answer. The right way, calmly read every line and ask, how does this new sentence connect to what I already know? This is what top scorers do. They slow down, look at the big picture, and piece it together logically. Part 2, Chronology. Put the story in order. USMLE writers love to give information out of order. Example, a 25-year-old woman comes to the ER with chest pain for 3 hours. 7 days ago, she took a long flight. 8 weeks ago, she started oral contraceptives. This can feel confusing at first, but here's the trick. Mentally put the events in order. Chronological timeline. 1. She starts taking birth control. 2. 7 weeks later, long flight 3. A few days later, chest pain. Now it makes sense. This is probably a DVT PE. Your brain understands stories much better when they're in order. So take 3 seconds to mentally rearrange the timeline. You'll understand the case more clearly and answer more confidently. Part 3, Severity. Match the right treatment. About 40% of Step 2 questions are based on management decisions. And the key to management questions is, first, what's the diagnosis? Second, how severe is it? Let me give you an example with diverticulitis. 2 different cases, same diagnosis, different severity. Case 1, mild diverticulitis, low-grade fever, mild abdominal pain, stable vital signs. Patient came to urgent care, not the ER. Management, IV fluids, IV antibiotics, NPO, nothing by mouth. Case 2, severe diverticulitis, high heart rate, low blood pressure, severe pain, confused mental status, low perfusion to brain, oliguria, low urine, kidney perfusion is dropping, came directly to ER. Management, emergency surgery, key lesson, don't memorize one-size-fits-all treatment. Instead, read for clues about severity. More severe, more invasive treatment, less severe, less invasive treatment. This simple shift helps avoid mistakes, even for students from top schools who already know the content but miss the context. Closing, put it all together. So here's the context, chronology, severity framework again. 1. Context. Don't fixate on one buzzword. Ask, what fits together? 2. Chronology. Rearrange the timeline in your head. Make the story flow. 3. Severity. Use clinical clues to decide how sick the patient is and how aggressive the treatment should be. This method helps you read smarter, not harder, and it works across Step 1, Step 2, and shelf exams. If you're tired of memorizing random facts and still missing points, this framework can make a huge difference. Subscribe for more strategies that help you think like a physician, not just a test taker. Bonus scenarios for practice. Painless hematuria plus smoker, weight loss. Think bladder cancer even if your analysis looks clean. Confused elderly patient with UTI signs. Confusion equals severe, admit IV treatment, not outpatient. Sudden onset dyspnea, calf pains, recent surgery. PE is likely, even if oxygen is normal. Hypertensive emergency with chest pain, papilledema, requires immediate IV meds, not oral pills. Let me know